Good morning. My name is Eddie Jimenez. I'm going to talk about the atenolol versus losartan in children and young adults with Marfan syndrome. The background and definitions. The aortic root dissection is a leading cause of death in Marfan syndrome. Studies suggest that with regard to slowing aortic root enlargement, losartan may be more effective than beta blockers, the current standard therapy in most centers. Definition of Marfan syndrome. He is an inherited condition characterized particularly by skeletal change, displacement of the lens of the eye, and a tendency to develop aneurysms, especially of the aorta. Losartan is an antihypertensive drug that blocks the action of the physiologically active form of angiotensin, and atenolol is a beta blocker used mainly to treat angina and high blood pressure.
Marfan syndrome. Marfan syndrome is an inherited genetic disorder that affects connective tissue. The connective tissue serves to hold together body tissues and cells. As a result, Marfan syndrome leads to abnormalities in blood vessels, eyes, lungs, bones, and the heart. The main symptoms are therefore a high forehead and long limbs, as well as long, thin fingers, pectus carinatum, flat feet, a narrow face, a small and thin jawline, loose joints, and eye and cardiovascular disorders. In most cases, the syndrome is caused by mutations in the FBN1 gene on chromosome 15. The FBN1 gene that encodes the protein fibrillin is a major component of connective tissue. When this is damaged, certain structures break down, like blood vessels. The initial diagnosis of Marfan syndrome is completed by evaluating the signs and symptoms. Nevertheless, a genetic study is needed to conclude with certainty the clinical diagnosis. The study provides information about the responsible genetic mutation causing the disease. Having identified the mutation, it is then possible to carry out prevention so that subsequent generations are not affected, as well as studies of other family members to see whether they are affected and to what degree. It is a genetic syndrome passed down from generation to generation, and more specifically, it is inherited as autosomal dominant, meaning the probability of transmission is 50%, regardless of gender. As an example, an affected individual with 4 children would have the probability of 2 of their children being affected by the syndrome and 2 healthy, although the probability does not indicate absolute terms, whereas the other 2 would be healthy, although this is not absolute. This means that perhaps all 4 would be affected or none at all. And so in most cases, the affected parent has at least one offspring that is also affected by the syndrome. In 20% of all cases, the parents are unaffected and the syndrome is due to the emergence of a de novo mutation in the FBN1 gene. That person has then a 50% chance of passing the syndrome on to his or her offspring. The incidence of the syndrome is 1 in 10,000 people. The only way to ensure healthy biological offspring.
Applications and medicine. They conduct a randomized trial comparing losartan with atenolol in children and young adults with Marfan syndromes. The primary outcome was the rate of aortic root enlargement, expressed as a change in the maximum aortic root diameter CT score indexed to body surface area hereafter aortic root CT score over a 3-year period. The secondary outcomes included the rate of change in the absolute diameter of the aortic root, the rate of change in aortic retention, the time to aortic dissection, aortic root surgery or death, and somatic growth, and the incidence of adverse events.
Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Now, before we get today's lecture started, please remember to access your free quiz and preview our cool, nifty new study guides, not here on YouTube. Click the link right up here at any time during this video. All right, guys, let's begin. Okay, next is B for beta blockers, which puts the brakes on the heart, ending in LOL like atenolol. So think double L's means double lows. L for low heart rate and L for low blood pressure. So we always check both heart rate and blood pressure before giving. Now, pharmacology exams love to ask about the 3 negative tropics. So guys, beta blockers put the brakes on the heart. So negative chronos means less time, negative ino means less force, and negative dromotropic means less speed of conduction, which results in less beats. Now these fancy words just means that we get a decrease in resistance, workload, and cardiac output, which makes it bad for our patients in acute or that worsening heart failure. So for the mechanism of action in beta blockers, just think beta blockers block beta receptors in the sympathetic nervous system. Just fancy words for blocking beta 1 for one heart, and also blocking beta 2 for 2 lung. And since most are non-selective, or aka non-cardiac selective, we end up blocking everything. So we not only get a slow heart, but we also get narrowed bronchi in the lungs, basically called a bronchospasm. So we usually hold this drug for COPD and asthma patients. So to help you remember the most dangerous side effects, guys, write down these 4 B's here. Bradycardia and low blood pressure, we hold the drug. This is always on the NCLEX. So any heart rate less than 60 and any blood pressure less than 90 or 100 systolic. Guys, we don't give the drug. And since the drug affects the blood pressure, we always teach the patients slow position changes to avoid passing out, aka orthostatic hypotension. Next B is for breathing problems. Since beta blockers block beta 2 in the lungs, we get these bronchospasms, commonly heard as wheezing. So again, never give to asthma or COPD patients. Next B is bad for heart failure patients. It can worsen heart failure patients, guys. NCLEX keywords here, write these down. New edema, worsening crackles in the lungs, rapid weight gain, or even new JVD. All indicate a new heavy fluid, or basically worsening heart failure, which is a big priority. We always report these key words, always new or worsening findings, to the HCP, or basically to the doctor. Our last B is for blood sugar masking in our diabetic patients. So sugars below 70. Beta blockers commonly hide the signs and symptoms of low sugar, that hypoglycemia, hiding the cool, the shaky, the clammy, and even hiding that high heart rate. So guys, we want to monitor our sugars closely, since low blood sugar means low brain function. Or basically, hypogly, the brain might die.
The pros and cons. They found a small but significant difference in favor of atenolol with regard of the absolute medium and serious score for the aortic annulus. This finding was unexpected. Without a clear physiological explanation, they also found that diastolic blood pressure was slightly but significantly lower in the atenolol group than in the losartan group. The cons were that in this randomized trial comparing losartan with atenolol in a large cohort of children and young adults with Marfan syndrome and a dilated artery, they found no significant difference in the rate of artery dilation index to body surface area between the 2 treatment groups over a 3-year period.
Marfan syndrome affects males and females equally. It affects all races and nationalities. It affects about 1 in 5,000 individuals or so. So that's almost the same prevalence as some other better known disorders like muscular dystrophy or sickle cell anemia or cystic fibrosis.
Marfan syndrome is a genetic disorder with distinct features, including unusual height, long, lanky limbs and fingers, flexible joints, and a sunken chest. This disorder weakens many organ systems, including the skeleton, lungs, eyes, and heart.
The cardiovascular system, or the heart involvement, is an enlarged aorta, and that's the major blood vessel that carries the blood away from the body. If not appropriately recognized and then treated with surgery to replace the aneurysm or enlarged aorta, Marfan syndrome can be fatal.
Tests showed Tiffany was at high risk of an aortic tear or rupture. So she chose to see Dr. Alan Braverman at one of the country's largest Marfan clinics here at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis.
When I came here, he immediately said I needed to deliver the baby here, and I knew that it was a life-threatening situation.
She was at very high risk for aortic dissection, but the risk of surgery then was also high for difficulty in survival of her fetus. So she saw a cardiac surgeon, she saw the maternal fetal medicine. She actually moved to St. Louis to stay on our campus, so if any issue came up, she could get emergency attention.
It's a great program. All the components necessary to make the diagnosis are here, and most importantly, the people that treat it are here.
At 36 weeks into her pregnancy, Tiffany had an elective C-section and delivered a healthy baby boy at Barnes Jewish Hospital. 2 weeks later, she underwent heart surgery.
I was afraid when I went into surgery. I was scared, and I actually cried on the operating table and told the nurse that they had best take good care of me because I needed to be here for that little boy.
This is a type of surgery that should be done by a surgeon highly skilled in aortic surgery in individuals with Marfan syndrome. It's not as common as bypass surgery, so an expert team of surgeons and anesthesiologists, etc., are necessary to make sure there's great success.
Before this preventative surgery, the average lifespan for a person with Marfan syndrome was between 30 and 40. Now, with medicine and surgery, these patients go on to live normal lives well into their 70s and 80s. That's why doctors at Barnes Jewish Hospital want to increase the awareness of this disorder. They want healthcare professionals to know what to look for, and they want patients to know there is a place they can go to receive top-quality care.
So patients want to come and they want to feel confident that their caretakers know what they're doing, know how to manage them, and will take care of them. So I think that's our biggest strength.
I can't say enough good things about Dr. Braverman. He and his staff definitely saved my life.
We have the issue apply in Ecuador. The molecular research in Marfan syndrome has contributed to the development of new therapeutic strategies in Ecuador. Traditionally, therapy has included the use of propranolol and other beta-adrenergic blocking agents in order to lower blood pressure and thus prevent aortic dilatation. With regular follow-up and proper management, patients have a life expectancy close to that of the general population. And finally, we have the conclusions. That is that among children and young adults with Marfan syndrome who were randomly assigned to losartan or atenolol, we found no significant difference in the rate of aortic dilatation between the two treatment groups over a 3-year period.